Welcome to the STARS program, seniors taking active roles in society. And now, here's your host, ANITA FINLEY.
Clear aligners are actually they're clear braces. So they're meant to move teeth that are crooked or out of place into their correct alignment.
Okay.
What makes them nicer than traditional conventional braces with the wire and the brackets is that there's no metal, they're clear. If you don't tell people you have them on, they can't tell, they can't see it.
See, that's the problem with this metal braces,
and that's why
right?
most people don't want to get braces, especially as an adult, because they don't want people to see them with the metal in their mouth. And the metal in the wires in the mouth keep you from being able to eat certain things. Everybody knows you have braces, you can't eat gum, sticky candies. With the clear aligners, you just take them out, eat what you want, put them back in. Well, clean first and then put them
Now
back
that is magnificent.
Mm-hmm.
I was just going to ask you about. It's one thing for somebody to feel that it's not attractive, but the other is it always got stuck. I never had them, but everyone who I know who had them used to have to do. I don't know how they even clean their teeth. It's very difficult.
Yes. It's challenging to clean braces even for hygienists and dentists. We usually schedule out a little more time to clean people who are under ortho care, which in our office right now is mostly children who get still the wire and bracket type braces. But for adults who maybe just want a little cosmetic straightening of their teeth look crooked, they have spaces, gaps, clear aligners are a great alternative. It looks nicer. I can't say enough about them and how happy my patients are if they just want one tooth tweaked, it's out of alignment, or
You can put one on.
You put on an aligner, and that aligner you change every month. And I'll go back and explain how this works because we kind of started talking.
That's right, we did. It is very confusing.
You do an impression. And every month we change the aligner slightly so that it moves the teeth gently. And it's less painful than the metal braces. It takes less time. And for little minor adjustments and misalignments of teeth, they work very well.
So even an older adult can still move their teeth.
Yes. And I find people are surprised by that. Oh, I've lived with my crooked teeth all this time and I hate them. Or they're hard to clean. There's a lot of reasons you might look at someone and say you want to straighten out your teeth. So let's start at the beginning. The patient comes in, and I usually don't recommend clear aligners for everyone. It's when I see someone who has difficulty cleaning, very tight spaces between their teeth. If I see that, then yes, I'll recommend get some aligners. Think about getting aligners and lining up those teeth. And then patients always say to me, I can still straighten my teeth. It's a bonus that I straighten my teeth. They're easier to clean because they're straight. And people don't have to see braces. It'll take maybe 6 months. I wear these aligners during the day. I only have to take them out when I eat, put them back in.
And at night, do they wear them?
They wear them at night.
So there's
wear it all through the day and
no
at night,
way that they're going to slip out and they're going to swallow them.
No, they're too big for that. They fit over all the teeth. They cannot swallow.
All right, and so how long has this been around? Is this pretty new?
It's fairly new. Clear aligners to move teeth as a concept has been around since about 2002. So it's been around long enough for them to perfect the system. And it doesn't do as much movement as the wire braces. So if you need a lot of movement, if you have jaw bones that aren't in alignment, you'd need to have the wire braces done, and that's with the specialist. But if you just need small movements to improve cleaning, keep stain from getting caught between crooked teeth and misaligned teeth, these are the way to go.
Do you feel them moving?
Well, anytime you move teeth, you feel them moving, but it is not painful because it's such a slow movement.
Yeah, that's right. I mean, so
it's not a painful
So
thing.
It's not like I'm sitting there all of a sudden my teeth are moving.
No, it's not like that. What happens when we move teeth is that we put such gentle force on it that force just causes the normal remodeling of the bone to change a little bit. You're always overturning bone. You're always making new bone to match how you are. If you ever see those crime stories where they go and they say, well, let's see what this person looks like based on the shape of their skull.
Right.
The reason they're able to do that is because the muscles put pressure on the bone and changes the shape of the bone. So based on that, many years ago, they developed braces to move teeth slowly through bone. We know that pressure on bone makes bone grow in certain directions. It's a little more complicated than that, but I think most people have seen where you look at a skull and, oh, this person has big cheekbones or small cheekbones. It's because of the motions of the muscle and the pressure muscle puts on your bone. We do that same thing with braces, put a little pressure on the teeth to change the bone. The bone remodels slowly. You don't feel it the same way my face may be changing from the way my muscles move, but I don't feel it.
Uh-huh.
Isn't that interesting?
It is very interesting. I'm learning all about this. So tell me about children. So when children have braces, it must work quicker because their bones are just so
it is
fragile.
It's easier to do bigger treatments when you're younger. But if you have crooked teeth as an adult, you're not going to be moving jawbone as an adult. You're going to be moving teeth through bone. I know.
I got that. No, I do. That you make it very clear. So, we've talked about, and we call them alignables.
Aligners.
Okay,
clear
alignable.
aligners.
Right. You can get your teeth.
If you say clear braces,
Clear braces.
Right.
Yes.
Your dentist knows what that is.
Okay. Well, now I think this will help people to understand this. When would you recommend this? Let's say someone comes in and you're handling all their, their cleaning, and if they have cavities, and what would make you say to them, had you considered aligners?
If the patient has spaces between their teeth that they don't like. So that's very much aesthetic. So somebody comes in and says, I've had these spaces between my upper teeth, all my life.
That's my calling card. Everybody knows. Oh.
What's that?
No, I'm saying, I've had it. Everybody recognizes this way. Were they going to recognize me if it's closed up?
Oh, well, that's why it's their choice with if you have spaces and you say to me, I don't like my spaces, what can I do about them? Then I can say, well, you know what? Aligners can close those spaces up for you. If you've always wanted your teeth to be close together, that's something you can do. Some people don't like having a gap between their front teeth. Some people love it. So just like some people might say, oh, I want to have red hair today and blonde hair tomorrow.
Well.
And I say, well, I want my hair to be blonde. I've always wanted to be blonde.
Right.
Then you dye your hair blonde.
Yeah, but this is pretty serious
it's a
stuff.
Cosmetic choice. Right.
And I've noticed in your upcoming article, even though I want people to read it, but I'll tell them that you want to be careful where you go, because one thing that Dr. Beresford does is she really keeps the price down. And that's very important, isn't it?
Yes. Braces with a specialist, if you go to a specialist and do conventional braces in this area, running about $6,000, $5,000-$6,000.
Is that right?
Right. Most adults getting braces are having minor movements for cosmetic reasons. They've gone there because they just want a little change with their smile. As you've gotten older, your smile, as we all get older, our smile tends to collapse and the teeth crowd in on each other. And that's something that's easily corrected with aligners that are less expensive than wire braces.
Well, what?
I mean, we're talking, you can be as low as about $1,500 if you just want to move a few teeth on one arch, like just the upper or the lower.
And how is it painful to put them in the first time?
At first, they're a little uncomfortable.
Because it's something new.
Right, it's something new. But after about 24 hours, you get used to feeling the pressure on the teeth. At most, I've had people say, oh, I took an Advil and it was fine.
But, when you think about it, this is really the new technology of society. I mean, we wouldn't have thought about anything of it like this. Even going and saying,
I have difficulty cleaning and my teeth have changed, something's different. And that is something that does happen. They tend to get more crowded and more difficult to clean as you get older.
Oh, is that true?
Especially if you've lost some teeth. So that'll make it more
difficult. So if you've lost teeth, it makes it more difficult.
Your teeth will shift. If you've lost bad teeth, they shift and close up a little bit more. And that can make even your front teeth more difficult to clean, leading to bigger health problems like decay, stain, which is unsightly, or cavity, or periodontal disease, because you can't clean as well as you used to.
So if an older adult comes in, I guess they come in for a cleaning, and then you, of course, get to see what else. You take x-rays to see what else they have going. So do you have like a program that you say, let's check this, let's check that, go through a whole, so that they'll be totally aware of what they need? They may not want to do it all, but you tell them what they could have.
Right. So if the patient comes in and they say, okay, I do want to straighten out my teeth. I know I'm coming in for this. I know you do clear braces and I'm interested in that. The first thing we want to make sure is that the patient is healthy. We don't want to start putting forces on teeth that have unhealthy bone, which may be periodontal disease or gum disease. Make sure your teeth are clean.
Oh, that's very important what you just said.
Right, because you don't want to put forces on teeth that aren't healthy and end up breaking teeth or losing teeth. So you want to make sure you're seeing a dentist for this. There are some programs out there that I'm uncomfortable with that are from outside the country, that are people send a model they take themselves and send
and
out,
they do
and they
this
just do this at home, and
Yeah.
it's a disaster.
Yeah.
I've had 2 patients so far come to me trying to get out of contracts where they've done it at home themselves, and they didn't have their teeth checked before, and they need fillings, and now the aligner's not fitting because they needed this work beforehand and hadn't seen a dentist, and hadn't had an exam. So it's important that you see a dentist, that you're monitored regularly by a dentist. What if you get a cavity and you need to continue your treatment? You want to make sure that this aligner fits you no matter where you're going. So you want to be under the care of a dentist having your teeth straightened.
Talking about cavities, does one know they have a cavity, or when you examine them and you have a comprehensive examination, you
Not
discover
always. Some people do not feel sensitivity with cavities. If the cavity is small, most of us don't feel it. And then I'll go in and I find the little hole in the tooth, which is what a cavity is, literally a cavity, a hole, a soft spot in the tooth. It's better to fill it when it's small and not painful than to wait until you feel something and have a tooth treated.
Right. I think that's very important that you just said that. It's the other part about this is that I think that dentists, and they say, oh, well, they're going to tell me this and that, and all of a sudden I go in, I feel fine, and now I'm going to have all these problems. I guess that's not, a really good dentist, that's not going to happen, right?
Right. Yeah. And you need to feel comfortable with who you're seeing.
Right. And that's why I'm glad
you sit in the chair and you're uncomfortable with what the dentist said, get a second opinion. I'm not ever insulted if a patient says, well, I never had problems, but you haven't been to a dentist in 5 years. Why don't you get a second opinion? And I don't have any. I would probably be the same way. I don't have pain. I have no proof. I have no way of seeing in my own mouth. So you go, see somebody else, see how you feel. Maybe you just didn't mesh with that person personally. And it's important that you meet a dentist, speak with a dentist that you feel like, I get this person. I feel this person is talking to me on my level. I feel this person is honest. And if you don't feel like that person is communicating with you, if they can't show you the reason why you need work done, or you can't understand what they're explaining, it's not necessarily that they're a bad person, but maybe you're just not connecting with them. And it's okay to shop around if you want to find someone you're comfortable with.
But see, being on the radio, people see you, they hear you. It's very important because that way they're not going to be surprised. They're going to come running to you. If they're looking for a dentist, I think they're going to come running to you. And it's interesting that years ago, I didn't know very many female dentists. Is that true?
There are a lot more of us now.
But years ago, weren't they mostly male?
It was mostly men, yes.
And so what attracted you to this profession?
I like it because I enjoy working with patients. I like science, medicine. However, I want to have a family. Yeah. And I wanted to have the time to spend with my family. And dentistry has very normal, regular hours. I'm working 9 to 5, 9 to 7 sometimes, but it's daytime hours. If there's an emergency at night, the patients just call and leave me a message, and I call them back and make sure they get medication that they need if they need something for pain. But by and large, I'm not on call in the middle of the night.
Exactly.
I have to run to the hospital. So that was a big benefit for me because I always knew I wanted a family.
Exactly.
So.
And so you do the work, but you have dental assistants, you have people who
Yes.
do the cleaning and
I have a
the
hygienist.
hygienist.
I have a dental assistant. So the hygienist will do the cleanings and the assistant assists me. Sometimes she takes the x-rays.
Hmm. Tell us exactly your location and how to get there.
We're on the corner of North Military Trail in West Palm Beach and Community Drive. So we're on the southwest corner. And it's actually really easy to find. If you live in West Palm Beach, you probably know both of those streets.
Yes.
And we're in the southwest corner.
And how long have you been there?
I've been in that location for 2 years. And prior to that, I was further south in West Palm Beach for 13 years.
So you have been practicing for 13, besides these new 3 or new 2.
Mm-hmm.
You're so young. It's you really decide you did this probably right out of high school. You went to college and
well, yeah, I did go to college.
right,
but
and then but you're young. You're
good genes.
Good genes. Yeah, she is. Well, you're very, very smart. It's true, and you're very sweet, and I think that's important because I said something before about people, Dr. Beresford, who somehow have a fear of dentists. It's ridiculous, I don't know why. This comes from something, but they shouldn't.
Well, no, it's the same thing I was saying before. I don't think it's ridiculous because you can't see what they're doing. I have people
you
come
can't
in
see
all
what
the
they're
time.
doing.
No, that's really what I think the fear is based in. For some people, they've had bad experiences with dentists. That's true. But the reason most people are afraid is they can't see. Really, if I'm working in your mouth, you cannot see what I'm doing moment to moment. When they go to a physician and say, okay, you're going to get a needle. You can see the needle clearly. You can see where they're going to put the needle. You know it's going to pinch. You know where it's going to pinch. When I'm working in your mouth, you don't know. There's a lot of uncontrolled feelings. For me, it's akin to when I fly. I'm a nervous flyer.
Are you
I
really?
don't like to fly.
Because you're not in control?
I'm not in control. And then I felt, oh my gosh, that's so awful. I got in a helicopter and the pilot was right beside me when
So you didn't feel the same thing?
No nervousness. I'm looking right at the pilot and I realized, oh my gosh, my fear is because I'm not in control on the plane and I can't see the person who's in control.
So have you ever asked anybody to go into the pilot's chamber? I say, I'm afraid they won't let you, but...
When I got it, I didn't know until I rode in a helicopter. And I was like, oh, I'm fine. He's fine. I'm fine. Everything's
helicopters
good.
are more scary.
So, and you would think I'd be more afraid of a helicopter.
Exactly.
No, that's when I realized, and I said, you know what, my patients probably the same thing. They're probably nervous because there's very little control. You couldn't move out of the way because you don't know where it's going.
Right.
When it's the doctor, you can say, oh, wait, hold on.
Right.
If I'm already in there, where you know?
Exactly.
So I do understand that it's a real fear. They really are uncomfortable. So letting people know what's going on, what they need done, what's going to happen for the day, if they want to know. Everyone's different.
You can always give them a mirror to watch, but I don't want to watch.
Right, that's you. Some people want to watch.
Do they really?
Yeah. And some people are like, oh, can I watch? And I'm like, well, when it's not in my way, you can
Oh, right. I can imagine what that's like.
It makes them more comfortable. And most of the people who say that to me, after a while, they get bored and they're like, oh, okay, I'm good. I'm done. And it's just a matter of control and comfort. If the person wants to see everything, I show them everything. If they don't want to see anything, I've had people come in and say, can you cover my eyes so I don't... I'm like,
oh, are you kidding?
Sure?
Are you kidding?
I'm not kidding.
Cover my eyes?
They say, I'm going to close my eyes until you're finished with the needle part. And I'm like, totally fine. That's totally up to you. You can close your eyes. Just open your mouth. I make a joke out of it.
Yeah.
Just go. You can close your eyes all you want. If you open your mouth, it's no problem. And you just work with the person.
It's a funny question. Has anyone ever bitten you?
Yes.
I didn't know.
That's a part of the job.
Oh, really?
I work with kids too. It's
family
general
dentist,
practice.
right.
So kids get confused sometimes and they bite you. And the funny thing is, I've had adults bite me when they're numb. So they're numb and they think, oh, that's your finger. Oh my gosh, I'm so sorry. But kids, they feel so bad. Like they feel like, oh my gosh, I bit you. But usually you're numb, so you're not even biting me. Like you close, I know to get out of the way. So they might get the glove or something. And adults are like, oh, I'm so sorry I bit you. Kids feel so terrible because they think you bite. If I bite you, it must hurt. I'm like, oh, no. It's usually not bad.
So now, there are 2 ways. If you have some serious dental work, there's sedation therapy. It's sedation dentistry, and then there's just with Novocaine or whatever else you use.
Mhm.
Do you do sedation dentistry?
I do what's called oral sedation, so I provide medications for patients. They just need somebody to drive them because they're going to be a little lightly sedated
Okay.
for a few hours. I give them a prescription, and they go home and they take this prescription, and then when they come in, they're nicely relaxed and they sleep through pretty much the procedure.
Really? And you
They just
can
need somebody to drive them.
and you can manage working on their teeth with their
Yes.
sleeping?
Yes.
How do they keep their mouth open?
Well, we have mouth props if they can't, but usually people under light sedation can follow directions, so they'll follow directions, but they also don't need as much pain medication because they're relaxed, they're at ease, so usually they need less medication as well, and they just follow directions, and they're breathing normally, they're just sedated enough so that they're sleepy, relaxed through the procedure.
Huh. Yeah, I was wondering about that. So there's some really serious sedation dentistry where they're getting
IV sedation.
Yes,
I can
IV.
refer to a doctor that provides those
exactly.
services if a patient needs it or wants it.
Right. Now, are you doing? I know you are doing implants.
Yeah, I do implant restoration and
Implant restoration.
which is
so
the tooth part, and I have the surgeon place the implant. So
I see.
The surgeon does the surgical portion, which is the part that goes into the bone under the tissue. It's a fake root.
Yes.
It's a fake root for the
Yes.
tooth. Then I put the tooth on that root.
I see. And what is that tooth made of?
The tooth itself is titanium and porcelain and high noble metals like gold and titanium.
So the tooth that's showing is
Porcelain. So it
Porcelain.
would be white. The outside is white. The reason why it's stalled is there's all different kinds of crowns. And when you put the implant in, there's a post that goes in that implant that holds the crown, and that's usually titanium or porcelain, or it can be gold also. So
yeah, because
different
implants
materials that we
seem to
use
be
for
the
the
very
crown.
big thing now. And so do you have a lot of patients? Well, let's go back to
oh, I do. I have a lot of patients
that have
getting
implants.
Yes.
But there are people who now have dentures,
Mhm.
and they're happy with the dentures except they come out and they don't want it. Now I've heard of implants being partial implants, I guess they call that. Talk about that.
Okay, you're talking about implants to help hold in your denture.
Yes.
So if you have a denture that moves around, implants act like a snap, like it's something that the denture can lock into so that the denture doesn't move or click or fall out.
So should a denture be loose that happens?
It should not, but there are some people who don't have enough tissue, do not have enough bone for a denture to hold in at all. So it's not always that the denture was poorly made, but like we mentioned earlier, as you age, the bone changes and the denture stays the same, and then the denture won't fit anymore. It'll get looser. Once you lose teeth, you lose bone at a faster rate, and the denture becomes loose. After usually 5 to 7 years, everybody's different. Some people can keep a denture for 20 years, but that's not everything. The majority of people around 7 years, the denture's going to start clicking, moving, pinching. And they either need it adjusted or remade, or they may need implants to make it hold in the way that it used to.
Well, when someone has dentures, though, doesn't it, they lose their bone, don't they? Because there's nothing there to...
Right. The teeth actually act as a stimulus to help the body hold the bone in. So if you don't have teeth, you'll quickly wear away the bone where the teeth used to be. So that jawbone flattens out, and then there's nothing for the denture to hold on to. If that
So,
makes
yeah,
sense.
it does.
So
It does
at
make
first,
sense.
the denture will hold on to where the teeth used to be. There's like a ridge there where the teeth used
Yeah.
to be, and then that bone wears away, and if that bone goes flat, which in some people it does, implants are going to be the only way to hold a denture in. And it does a really nice job. Once they go in, they're not moving. You know, smile, you talk, there's not that lisping from a denture that you're holding in while you're trying to talk, and it's changing the shape of your face, and it's much more comfortable. Patients like them much better than conventional dentures.
So now you're saying you're putting in, what, a couple in a person's mouth? Or
2 to 5.
So they're implants. They're actually implants that are going in.
And
Rather
they're
than...
small. They're the size of a typical screw, maybe half an inch in length, and that's all you need to hold a tooth in, to hold a denture in.
So,
And you need,
so is it an actual tooth, an implant? They do put a tooth in there, or it's not a tooth?
it can be like teeth that don't come out. So you can get implants and then attach teeth that don't come in and out. It doesn't have to be dentures if you get implants,
Mm-hmm.
which is nice. You could choose, after not having teeth for a while, you could choose to do fixed teeth.
Mm-hmm. Well, the interesting part about that is it's a whole process, and you have to explain that. You have pictures, so if someone wants to come, and I want to do is to, give your information. That's really important, and I know I haven't done that, but let's just do that now so that we'll get some people to call you, make an appointment. That's the most important thing. Your phone number is 561-642-8601.
Yes.
Right?
8501.
Right. Is that what I said?
No.
Oh, 8501. 642-8501. 642-8501. And your website, let's see, westpalmbeachfamilydentist.com. Right?
westpalmbeachfamilydentist.com.
And the phone number again is 561-642-8501. 8501. Okay, we've got that, and it's Beresford, Beresford, right?
Right.
Estelle, it's wonderful having you here.
Oh, it was great talking to you, Anita.
Thank you.
you.
Okay. Thank you.